Hello, this is Siddharth Tambar, the physician from Chicago Arthritis. Today I want to discuss what are expected results from a regenerative medicine treatment for osteoarthritis. First and foremost, it's very important to understand why we think these treatments work and to differentiate it from maybe the more traditional orthopedic surgical model for care. So the traditional model for care is based on really a strictly or predominantly structural model of care. It's the kind of care where you can look at an x-ray and say that your chance of getting a result might be X, Y, or Z based on how an x-ray looks. That's different than how the regenerative medicine model of care works. Realistically, you can't look at an x-ray and say that somebody is a good or poor candidate based on strictly what you're seeing on an x-ray. And you can't really look at an x-ray and judge a result based on a future x-ray as well. The way these kind of treatments work is they work on a more physiologic model of care rather than strictly a structural model of care. What that means is that the things that we can improve upon are improving soft tissue stability to improve function and functional stability in a joint. We can improve the biologic activity within a joint, the microenvironment, the overall health within a joint. We can improve the inflammation in a joint as well. All of these sorts of things are what lead to an improvement in pain, stability, and functional improvement for patients. So if what you've been told is that your results will be based on how your x-ray will look 3 to 6 months down the line, that's really not a physician who understands how these treatments work. On the other hand, if your physician is telling you that you will not respond because your x-ray looks in a certain manner, they probably don't quite understand how these treatments work as well. As with most aspects of medicine, you always want to pursue treatment with people who have more experience and expertise based on treatment. And to me, that is first and foremost expressed based on someone who understands that these treatments are based on a physiologic model of care rather than a structural model. If you proceed with that, then I think the chance of getting a better treatment and responsive treatment is likely, namely because your physician will be basing treatment not strictly on where you strictly have an osteoarthritic joint, but based on not only where the joint is damaged, but also the other soft tissue structures that provide stability and support as well. And longer term, that's going to give you more stability and pain relief as well. I think if you pursue treatment in that regard, your chance of getting a better outcome is certainly more realistic and expected. And I think you'll be more pleased and happy with the outcome that you eventually end up getting. Pursue treatment and an understanding of regenerative medicine for arthritis based on a physiologic model of care rather than a structural model of care. I think that's a more appropriate understanding for how platelet-rich plasma and bone marrow-derived stem cell treatments work. And I think that'll most likely get you to the place that you want to be in terms of eventual responsive treatment. I'd love to hear your comments on this idea or your thoughts on this. Send me an email. If this is on a social media site, leave me your messages. And thank you very much for your time and look forward to talking to you soon. Bye-bye.